Welcome back. We are answering your questions about coronavirus with Cone Health's Infection Prevention Medical Director, Dr. Cynthia Snyder. There is a number at the very bottom of your screen, and that is how you get us your text question, 336-379-5775. All right, in the queue already, Dr. Snyder. This person says, what does a hospitalization overage look like? And when does Cone expect patients to exceed that capacity? I know we've all seen some video from other places like in California where they're using parking garages to set up triage and all that other kind of stuff. So what does it look like here?
So it involves a couple different variables. When I think of Cone Health, I think of, all the campuses we have. And some days already this week, we've had, where they're already at capacity. In terms of like caring for COVID patients, by the end of the month, we are very stretched and really have to think of alternatives of what to do. We are still in that process now. We'd like to try to anticipate what to do. And we're right now working exceptionally hard at decompressing our emergency rooms. And in order to open up some more hospital beds, it really involves us also postponing elective surgeries. So right now, I know a lot of our surgeries have been postponed.
Mm-hmm. This is kind of a follow-up question. They say, why is the increase in hospitalizations and capacity filling up such a big deal for everyone, not just for people seeking COVID-19 treatment?
So I think it's one big bucket. All hospitals have X amount of spaces and X amount of beds, be it if it's being filled with people who have surgeries or other illnesses or COVID, it all is just this limited resource. And so the thing that's challenging too about being involved in the middle of a pandemic, it's not necessarily just patients that are coming up that have COVID, but a lot of our healthcare workers, unfortunately, are also contracting it from their community exposure. So our staffing is an incredible resource. So we also have to try to recruit a lot of traveling nurses to help.
Because it's not just the beds to put people in, it's people to help the people who are in those beds.
Correct.
Got it. Okay. This person says, in relation to the vaccine, once someone is given their second dose of the vaccine, how long are they protected for?
So that is a good point. And I don't think we quite know. We suspect that it's easily 6 months, and it may be much longer than that. It really depends to seeing how SARS-CoV-2 mutates, mm-hmm. and what it looks like on somebody that has neutralizing antibodies. I think the good thing to note is that, they've had people who've been vaccinated this past summer from clinical trials, and they're still immune, right? So they're good easily like 4 to 6 months out. And also people who've had COVID earlier in the year, a majority is still immune. So we suspect that this is still going to be a very good vaccine. I don't know, is it a once a year phenomenon, which could be the case, but it's still too soon to tell.
Okay, and that was somebody's question. Does it look like it's going to be like the flu, that you just need to get it every year? And so we don't know just yet. Okay. So this person says, has there been a big drop off in flu cases and flu-related deaths because of the precautions that we take for coronavirus? And if so, why hasn't coronavirus gone by the wayside like the flu?
So there's kind of a couple explanations. I think we are still very much like the Southern Hemisphere, where flu is really not is nowhere near where it usually is. We're not seeing as many cases, very few people who've been hospitalized for flu. And in part, it's really a lot of SARS-CoV-2 illness. And also with wearing masks, it does cut down on transmission with respiratory viruses. But again, we feel that SARS-CoV-2 is more contagious. So that we have to be like exceptionally vigilant. And I think the challenge is in a lot of our workplaces, if you're not wearing a mask, you're sharing a space and having lunch, or sharing an office and not wearing your mask, that's where you're potentially at risk of contracting it with somebody.
So that's a follow-up question as well. Am I better off right now if I wear 2 masks at the same time rather than just one?
So I think it should be fine to wearing just one mask, but as long as it fulfills like the CDC's guidelines, depending if it's like at least 2-ply, that it fits closely around your face and not below your nose. A well-fitting mask should be sufficient. But it's also about who's in the room with you. They need to also be wearing a mask, and that there should also be good ventilation in the area.
And be 6 feet away from you.
Exactly.
You just can't say, okay, we're both wearing masks so we can sit right beside each other.
Correct.
Right. Okay. All right. We're going to continue taking your text questions. We've got one more segment left with Dr. Snyder. We'll be right back.